Hi everyone, I'm Dr. Michael Johnson. Welcome to A Day with Dr. J, and this is episode number 8. Today I want to talk about insurance. I don't like insurance companies. All insurance companies care about is making money. They don't care about your health. They don't care about anything, but they want to take more money in and pay less money out. Especially health insurances. It's part of the reason we don't deal with health insurance. The second part is, and you can refer back to episode 1 and I tell you why I got into stem cell therapy because it helped me so much. I'm so passionate about it. It wasn't covered for me by my insurance. I paid cash for it. But people get really upset and they will blame me because insurance companies don't cover stem cell therapy. I don't control what insurance companies cover or don't cover. We do work with indigent patients. We do work with reduced fee patients. But I'm sorry, we can only accept a few of those a month. We're doing our part. And yet people get really ticked off at me personally because their insurance doesn't cover. We had a guy just storm out of here last week. When I told him, your insurance does not cover. Maggie told you that when you called to set the appointment. That's crazy. You know, we do offer healthcare financing. We've had patients use GoFundMe.com, and when I recommend that, some people get very upset. I'm not responsible whether your insurance covers or not. I'm not responsible for your situation financially. But yet, people beat the crap out of me on social media like I have control over it. I don't know what more we can do. The healthcare financing company we use offers 18 months no interest. So they ding us for that if somebody uses it. Yeah, it's insane that people feel almost this entitlement. Nobody's responsible for you except you. You know, I consider myself an independent politically. Maybe I lean to the right a little bit, but I'd like to think that government is here not for a hand out, but a hand up. I mean, I used student loans when I went to school. I've paid them all back. My parents, my mom and stepdad, didn't have a lot of money back then. In 1977 through 1983, I used something called a Basic Educational Opportunity Grant, BEOG. We qualified for it. My dad had really not helped us at all. That's a whole nother story. Yeah, I mean, I worked my butt off going to school. I worked at Roadway loading trucks in Rock Island, Illinois, and I didn't have to. I could have just kept taking more and more loans, but I didn't think or feel that was responsible. I mean, my wife and I scraped and struggled, and I didn't feel anybody owed me anything. But holy man, I'm just so tired of people going ballistic on our Facebook page at Optimal Health, Stem Cell, and Wellness, and Dr. Michael Johnson, board certified chiropractic neurologist, blaming us because their insurance doesn't cover it or they can't afford to do it. We're doing all we can. Like I said, the hospital over here can't afford to have an entirely free hospital. What doctor can? But yet people expect us to do that. We're doing everything we can, but I'm going to tell you up front, insurance is getting to the point where it's going to be catastrophic care. We're already seeing it. You're going to have deductibles of $5,000 or $10,000. That's our current deductible with my family. And I'll be right up front with you. That's a good thing because the cream's going to rise to the top. People are going to be very judicious spending their money, and they're only going to spend it on things that will help them. And I think Big Pharma is afraid of that. Because if you haven't figured it out yet, Big Pharma, the big drug companies, run doctors. They have reps go into their offices, and they run the show. I have physicians who are good friends of mine. They'll admit it. But don't blame us, don't blame our office if you don't have insurance or you don't have the means. I mean, we have a 4-year waiting list. That's how many people are on our list for indigent care. And some people want to get bumped to the top because they've come right out and said, I don't have 4 years to live. I can't help that. That's not my responsibility. My responsibility is try to get the people better in our office as fast as possible. If that is the case, we recommend GoFundMe, GoFundMe.com. Raise the money. Have your friends, neighbors, family help you. There's no shame in it. But don't blame me and don't blame our office, please, if insurance doesn't cover stem cell therapy. It's my email. If you agree or disagree, you're welcome to email me. If you send me hate emails, I'm just going to delete them. mljohnson at AskDrJohnson.com. That's mljohnson at AskDrJohnson.com. Subscribe to our YouTube channel, please. Dr. Michael Johnson and the Optimal Health Stem Cell and Wellness Institute. We're also on Facebook under Dr. Michael Johnson, Board Certified Chiropractic Neurologist, and the Optimal Health and Wellness Optimal Health Stem Cell and Wellness Institute. I'm getting a little punchy, and I apologize. We had a couple of tough patients this morning, so it kind of takes it out of me a little bit. So, I'm Dr. Michael Johnson. Thank you for taking the time. Make sure to subscribe. And try and always live from your heart. Take care.